Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an engaging and comprehensive show for you tonight. We're talking about shoulder treatment options and how St. Luke's experienced team of fellowship-trained specialists can help. We'll be joined by a panel of medical experts listening to patients' stories of success and taking questions from our viewers. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at shoulder treatments with St. Luke's University Health Network. Stay tuned. Thanks for joining us. Let's get started. We have a brilliant panel of guests tonight. Up first, we have Dr. Gregory Carolyn, who serves as the Chief of Orthopedic Sports Medicine and Shoulder Surgery, as well as the Associate Program Director for St. Luke's Orthopedic Surgery Residency Program. Prior to joining St. Luke's in 2008, Dr. Carolyn earned his medical degree at Rutgers Robert Wood Johnson Orthopedic Surgery Residency at the University of Pennsylvania and completed fellowship training at the University of California, San Diego in orthopedic sports medicine. He's board certified in both general orthopedics and orthopedic sports medicine. Prior to surgery, Dr. Carolyn uses technology to ensure a precise outcome and teaches this technique locally and nationwide.
I actually did suffer a shoulder injury myself at the end of high school, and I had to have surgery to stabilize my shoulder. So I found that as a way to get involved in the world of shoulder reconstruction and shoulder surgery. I think shoulder surgery is still evolving. It's one of the fields that we are discovering new techniques, new pathology, and ways to treat patients to help patients achieve better outcome, things that even a decade ago we weren't even sure we could do. And it's a ubiquitous problem. Patients injure their shoulders. It's a very unstable joint, given the configuration of a very flat socket and a very round ball. It leads to a high rate of injury, and those injuries can be quite debilitating. I actually do try to keep as on top of what's occurring as possible, and I am very proud of the fact that I've been able to be involved as faculty at the largest shoulder course in the world in San Diego every year. Helping patients is such a rewarding experience for me.
Dr. Carolyn, after choosing orthopedics as a specialty, how did you choose shoulders as your subspecialty and why?
Well, I was very fortunate in my training at the University of Pennsylvania, and then out in San Diego I was exposed to some of the world's leaders in the world of shoulder arthroplasty and intervention, and it was something that I kind of became gravitated towards. It was kind of early in our understanding of reconstructing shoulders, and it was neat to get involved kind of early on to see how we could advance the care that we're providing for patients back then, and then to follow that trend through to today. And it's always been something I've been interested in.
All right, well, we look forward to hearing more about those outcomes as well as the treatment options later in the show.
Great.
Joining our panel next is Dr. Nicholas Avallone, Medical Director of Sports Medicine and Chief of the Department of Orthopedic Surgery at St. Luke's Warren campus. Having completed medical school at Robert Wood Johnson, residency at Harvard, and fellowship at Lenox Hill in New York, Dr. Avallone is board certified in both orthopedic surgery and orthopedic sports medicine. He's been recognized as a top doc by Inside New Jersey and is the head team physician for multiple high schools and colleges in the state. Additionally, during his training, he assisted in the care of numerous professional teams and athletes.
Being able to help my patients is a very fulfilling and rewarding experience. My name is Dr. Nick Avallone, and I'm an orthopedic surgeon here at St. Luke's, and I specialize in sports medicine. Shoulder injuries are very common. Really, it happens to a very large proportion of the population, and really in all ages. It also affects folks who are in their 80s, even 90s. Being able to get them back just to activities of daily living is very rewarding. The vast majority of patients who come into the office with a shoulder problem don't need an operation. In fact, I tell people that about 90% of the people that I see on a daily basis don't need anything more than just doing physical therapy. I feel that we at St. Luke's Orthopedic Care give a full spectrum of care to people. I feel like we're able to take the patient from the injury to full healing in a very nice fashion.
Dr. Avallone, tell me a little bit about why you went into sports medicine and why you find that field in particular so interesting.
Well, it probably sprang from being an athlete myself. So many years ago, back in high school and college, having had some injuries myself, as well as knowing some other folks who've had them, just seeing the relationship between the athlete and the physician, and seeing how the physician was able to help that athlete get back out in the field, and it really seemed like a really interesting thing to do.
And a natural connection if you're a sports enthusiast, of course, because you get to stay immersed in that sports atmosphere.
Absolutely.
Excellent. Well, thank you for being here. We look forward to learning more. Let's meet our final panelist, Chris Fisher, a board-certified clinical specialist in sports physical therapy. Chris has a health science degree from Lock Haven University. He earned his Master of Science in Physical Therapy from Misericordia University and went on to complete his Doctor of Physical Therapy degree from Shenandoah University. Chris has worked with and treated a variety of orthopedic and sports medicine patients. Chris utilizes several methods of treatment that emphasize a hands-on approach, focusing around evidence-based practice. He believes in individualizing each person's treatment in order to meet their specific needs. Outside of work, Chris enjoys being active with his family.
I first started becoming interested in this field in high school. I knew I wanted to do something in the sports medicine realm, and I kind of fell into physical therapy after a lot of research. We get to look at the diagnosis, management, treatment, and prevention of sports-related injuries throughout the lifespan. So we're not just looking at, the 17-year-old football player or baseball player. We're looking at, from the 9-year-old gymnast all the way up to the 80-year-old who likes to play tennis. A lot of times, physical therapy can help with the injury-related issue. A lot of times we can help them in PT and return them to where they need to be before surgery is considered.
Chris, thanks for being here. Tell me a little bit about how your training in sports physical therapy started and what you find so interesting about this field.
Right, so each part of the field is different. It's not necessarily different per se in that if we have a total knee replacement in there versus someone who had a labral tear of their shoulder, we're not going to necessarily treat that patient any differently from a standpoint of what the end goal is. Maybe it's a higher level of function for the athlete, but overall it's going to be what is the patient's goal, and we want to make sure that they get back to their prior level of function at least as close to as possible.
Excellent. Well, thank you all for telling us a little bit more about what you do and why you went into this field. Now, in the next part of the show, we're going to dive into a deeper conversation around the treatments and the solutions offered at St. Luke's. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
My name is Trevor Sovius and I'm a pitcher for the Easton Area High School. 2 years ago I had a fall during the game, which actually tore my labrum, and I've been pitching with it ever since. I came to St. Luke's for a second opinion, and Dr. Carolyn sent me to physical therapy with Chris. My journey through physical therapy has been amazing. It took me 7 months of physical therapy with Chris, and I'm just excited to be playing again. Because of physical therapy, I'm able to return to what I love doing at my full potential. My goal is to be on varsity, obviously as a 10th grader, which is very rare. My dream is to go to Louisiana State University. I'm for sure going to be ready and excited for the season. I would recommend St. Luke's because they make you feel at home here. They do everything they need to and help you recover as you need it. St. Luke's has really been able to make me achieve my goals.
Welcome back, and thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our audience for being with us today and providing us with questions, which we'll get to later in the show. Joining me is an accomplished panel of medical professionals, Dr. Carolyn, Dr. Avallone, and Chris Fisher. We've started to discuss the basics of shoulder treatments and why they went into the field. Now we'd like to get a better understanding of what conditions our team at St. Luke's can treat. So Dr. Carolyn, I'll start with you. What are the common complaints? What are the most common things patients come in and see you about with their shoulders?
Typically, what I see patients, they break down to kind of either overuse type injuries from routine activities that may have gone too far or that continue to progress. Patients can develop symptoms from those type of injuries, or there's acute injuries, traumatic injuries, falling down the steps, slipping on the ice, getting injured in an athletic event, playing football, playing hockey, playing basketball. Those two types are the main varieties we see: acute or traumatic injuries, and then subacute or chronic injuries.
I was going to say, how often do you see someone who maybe is just sort of aging, or there's arthritis, or there's pain that developed maybe from something years ago, or just from the aging process?
Quite often. I think the more common injuries we see are the non-acute injuries, the overuse type injuries. Those injuries include rotator cuff pathology, rotator cuff tears, partial tears, impingement syndrome, and osteoarthritis, loss of the cartilage of the shoulder, which do occur over a long period of time. And that does have implications for how we approach them clinically.
You know, Dr. Avallone, Dr. Carolyn was mentioning that overuse situation that happens with so many patients. What are some activities or sports or things that people participate in that can lead to overuse?
Sure. Well, lots of sports can contribute to this. Certainly our throwing sports, such as baseball, softball, football, those are sports that certainly can cause shoulder problems. Be quite honest, you don't have to be an athlete though to get overhead, movement that causes pain. You could be simply painting your ceiling on a weekend, and you can have a lot of pain the next day from that.
Everyday use, you've got to be aware of what could be causing you pain. Well, Chris, that's when they might come to you. So if they're experiencing some sort of pain and they come to you for physical therapy, maybe even before they see one of the physicians, where do you start with shoulder pain?
Sure, like you said, before they might see one of the physicians, we get a referral from them, or sometimes people just come directly to us. A lot of times we're able to get them where they need to go without having to make that referral. The nice thing is that if they do need further consultation, that we are able to get them in to see an orthopedist and have further consultation if needed. And the program works very, very well.
Yeah, that direct access that you mentioned can really be helpful, and I would imagine, Dr. Carolyn, you find it helpful in your office. How do you find the communication between the physical therapists and the orthopedist within the network, and what is your approach to a patient when they come to see you with shoulder pain to know where they've been and what kind of treatment they've already had?
Yeah, one of the beauties of the system that we're part of, the St. Luke's University Health Network, is that we do have great communication with all providers, from physical therapists to primary care doctors to oncologists to radiologists, whatever it might be that we're working with. So we do have great communication, which I think furthers our ability to help patients develop a plan, have a consistent plan, and then improve with their symptoms. Most of these injuries we see, they do improve greatly with activity modification, with time, with physical therapy directed exercises. So direct access has been wonderful because patients can get treated and already be kind of on the way to getting better before they even see a specialist, or maybe even avoid seeing a specialist because they're getting better. It also helps avoid unnecessary procedures such as injections or MRI scans or even surgeries. If patients are able to get treated for these injuries without going to the next level, they're able to kind of avoid potential issues that may occur. So it's been a wonderful opportunity for patients to improve their symptoms without having to go see a specialist.
You mentioned some of the ways that a shoulder could be treated, and Dr. Avallone, I know sometimes people have hesitation to go to the doctor because they're afraid they're going to automatically need surgery. Talk to me a little bit about how you approach that initial conversation and that pain reduction that they might be looking for.
Well, the vast majority of folks who come to see us don't need surgery. In fact, I would say that about 90% of the patients that we'll see in our office don't require surgery at all.
Which is really good news and good for people to know because there are so many treatment options.
So we typically will end up doing conservative measures such as physical therapy. We tell folks to go ahead and use ice, heat, different anti-inflammatories, Tylenol to help them with their pain. But we're really having surgery as the last resort for the vast majority of issues.
Chris, when someone comes to see you and they're experiencing pain or loss of mobility and they're not quite sure how to get it back, how often do you see success from that pain relief through physical therapy? I mean, is that enough?
Sure, a vast majority of the time it is enough. When they come in, we'll evaluate them and make sure, that all their needs are going to be met. And we'll start with, increasing mobility, decreasing pain, and increasing function. And each patient is really different. Each patient does have a different needs. And a lot of the times, patients may come into the office from a referral from one of these guys that may have already had a MRI and did show some sort of abnormality in there. But that abnormality may not necessarily be abnormal for them, or may not be their pain generator. which then, generates the referral to us, and then we're able to evaluate and figure out, exactly where their impairments lie and what can we do to correct this. We're not going to correct the rotator cuff repair. We're not going to fix, or we're not going to fix the rotator cuff tear or fix the labral tear, but we may be able to fix, what's going on around the area that's actually causing their pain.
And I love that individualized approach. I think that gives patients such a comfort level. Well, this was really insightful information from all of our panelists, but we're not done yet. After the break, we'll learn more about treatment options for the shoulder. You're watching St. Luke's Health Now. Stay tuned.
Thinking back, I had about 20 years I was in pain after my career. I was experiencing a lot of jamming pain in my shoulder from pitching all those years, and it just kept deteriorating. And when it just quit the whole physical thing, because everything was pain, backwards, forwards, everywhere, every part of the range of motion was painful. Dr. Carolyn was magnificent. The whole operation, the time it took and the recovery time, he did an excellent job. But the recovery was very quick. 3 weeks I was having the sling off and then put it on at night so you don't roll over on the new operation, because that's still healing in there. My workouts, my range of motion is getting better. I mean, it's going to take a while to get, because I was looking for external rotation for my golf swing. I made some great gains. I love St. Luke's, all the people we work with here, and thanks to Dr. Carolyn, I'm back to golfing. I'm getting better. I'm getting better every day. Very thankful to St. Luke's. All good experiences.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo. We have a fascinating show for you tonight. We're talking about treatments of the shoulder. In case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, Dr. Carolyn, Dr. Avalone, and Chris Fisher. Thank you all for being here. In the first part of the program, we talked a little bit about why you went into this field. Then we've talked a little bit about what different injuries you see and why people come to you. Now we want to talk a little bit more about technology and what treatments options are available beyond what you can do in the office. So Chris, I'm going to start with you. If somebody comes to you and they've been recommended to have physical therapy, but they might need surgery or they're going to surgery, is physical therapy important to do prior to the surgery? Does that ever play a role?
And sometimes it does. If it is a hard fast that this person is 100% going to surgery, there are cases where they're going to have a rotator cuff repair, let's say, but their motion is really not doing well. It may behoove them to have some PT beforehand to increase some of their mobility so they don't struggle so much after the surgery itself.
Almost being prepared so that you can recover more quickly.
Exactly.
And then Dr. Carolyn, what are some of the options? Has technology allowed? You talked early on about the advancements you've seen throughout your career. Tell us a little bit about those treatment options.
Well, I mean, it's fascinating. About 15, 20 years ago, no one was really doing arthroscopic procedures, which are procedures through small incisions with a scope as a camera and smaller instruments that have been developed to do procedures we were routinely doing through big open incisions. That has now become a routine, and it's not even really thought about anymore as being a technological advancement, but it has advanced so we can do pretty much everything you can do in an open manner arthroscopically.
Which really has revolutionized the field, and I would imagine heal time for patients.
It helps patients recover faster. They still have the same surgery, so the recovery overall is probably the same, but they feel better faster. They're able to get back to work sooner, much less cosmetic disturbance to their shoulder. Rather than having a large incision, you have tiny small incisions. So that's probably one of the largest advances that have already occurred. Now going forward, it's the use of technology in the form of preoperative planning and templating to be a little more precise as to how we're doing procedures, mostly revolving around shoulder replacement. We're able to plan the surgeries ahead of time using a 3D guided software and even generate 3D printed models of the shoulder itself to bring into the operating room to then recreate what we're planning ahead of time to again achieve the goal of being much more precise in our reconstruction. That precision has led to incredible improvements in function, outcome, and patient satisfaction.
You know, Chris, nobody wants to hear the word surgery, but if they do, most likely they're going to come see you after. And that follow-up, I would imagine, is crucial to the surgeon's work really sticking and working and having that recovery. Tell me about your approach to patients post-surgical.
Absolutely. You know, the one thing that we want to make sure is the first time that they come in the office that they feel comfortable what's going on. They're usually, pretty nervous about what's going to be happening, especially if they just had a shoulder surgery and their arm's in a sling. We're going to get them out day one. They're kind of hesitant about that. So, making sure that we explain to them the process of what's going to be happening is important, and to understand what's going to be happening today, next week, and the months ahead in the recovery. From there, we'll go ahead and do the evaluation, see where they're at, and get their baseline, and determine what the plan of care is of going forward and to get them back to where they would like to be.
Dr. Avallone, how important do you find this technology and this team approach to be to the way you're approaching patients these days? And are there any other specific treatments that you want to mention that patients should be aware that are out there?
Well, certainly the team approach is, we feel at St. Luke's, the way patients should have their care. To be able to have an effort that is combined with different disciplines, we think helps quite a bit. The technology that Dr. Carolyn was just mentioning is really fascinating, and to understand that technology can be a little daunting at times for patients to really grasp some of the intricacies of it. But being able to communicate between the team members, I think, is vital to helping the patients go smoothly through their process, because everyone really would like to know, what's the next step, doc? Where am I going next? So having that understanding, I think, helps folks a lot.
Dr. Carolyn, what do you find most rewarding about working with your patients? Of course, you guys have all worked with professional athletes, college athletes, high school athletes, but what about that everyday patient that comes in that just wants to be able to pick up their grandchild? What do you find rewarding, and what are your goals when you're working with patients?
Well, part of what I feel is important with our job is identifying what expectations are that patients have. If it is picking up a grandchild, how can we help them achieve that goal? Is it through therapy? Is it through activity modification? Is it through injections? Is it through possibly surgery to help reconnect or reconstruct a problem such as arthritis or a rotator cuff problem so they can achieve the goal they wish to achieve? And there really is very few things in life that's more rewarding than identifying what someone wishes to do and then being able to provide them with the ability to do so. And the majority of times you're able to help patients. And I think seeing them appreciate that and really do appreciate what you do for them, which is a really nice feeling when you go home at the end of the day.
Absolutely. Well, I think it's so interesting and so fulfilling on so many levels. So we really appreciate all of this information, but there's still more to come. Up next, we're going to take questions from our live studio audience. I hope you guys are ready. Stick with us. You're watching St. Luke's Health Now. Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. This has been a great conversation, and I really enjoy not only hearing about the treatment options, but also your passion for the field. Also, we've had a great studio audience, and now it's their turn to ask some questions. So, are you ready?
Sure, ready.
Here we go. Having chronic calcified tendonitis for 2+ years and undergone corticosteroid injections every 4 to 5 months, what can be done to avoid potential surgery?
Well, great question, and we do have some options that patients probably aren't aware of. At St. Luke's, we have a couple radiologists that recently came from the University of Pittsburgh who've kind of pioneered a procedure where they do ultrasound-guided aspiration of the calcium in the rotator cuff tendon, and it's been very helpful. I just saw a patient today who had chronic pain for 2 years or a year and a half, unable to get her better with normal measures, injections, therapy. She just came back, she's 3 weeks out, and she's totally happy. She's no pain whatsoever. It's
That's
a minimally invasive procedure where they put an ultrasound probe on the shoulder, and they're able to, under guidance, take a needle, they numb it all up, and they pull the calcium out. And it's been very, very effective for that specific condition. So again, certainly happy to help see that person in the office, help to get them into the radiologist to see that, but it's a good option for that.
Great.
It's really been a game changer. I got to tell you, in our office, and I'm sure the same with yours, Dr. Carolyn, it's really been amazing to see folks who we may have operated on, and they would have had months of rehab and months of rehabilitation that they don't need that anymore. So that's really been a game changer for us and has really helped our practice quite a bit.
It's amazing, and the technology and the advancements are always changing, so I guess the message is don't be afraid to go ask, because This is new.
And that's why you see care at a place like St. Luke's. We're all on top of this stuff. We're all looking for the next thing. We're going to the meetings, we're teaching the meetings, we're reading the articles, we're writing the articles, we're reviewing the articles. We're all involved in the academic side of medicine so that we know what the next step is, what is out there for conditions such as that. And it's, again, rewarding because we're able to help offer that to patients.
All right, our next question is, are there any preventative tools people can implement to avoid serious damage?
Sure. So, you can always come in for an evaluation to determine to see if there's any type of dysfunction going on to begin with. I know, for an example, a lot of people like to lift weights, right? So they would go and lift weights, but they may be having some issues with some part of their cuff that may be weaker, may not be having pain. But over time, if there is some sort of weakness with part of the rotator cuff or some of their muscles called scapular stabilizers, and they're doing a lot of weightlifting overhead, that can lead to other type of issues down the road.
Excellent. All right, the next question is, Chris, this might be for you. If I hear and feel noises when rotating my shoulder, should I be concerned, and what does that mean?
Possibly, just because there's a noise there, but it's unsymptomatic, it may mean nothing, whatsoever. I generally am more concerned, and I'm sure these guys are more concerned when there's symptoms involved, with if there's a noise and it generates pain as well.
Get it checked out.
Yeah, and typically it's a sign of dysfunction, and I think that's important. We kind of mentioned it, but no one really alliterated it. The shoulder is complicated, as you mentioned earlier. When things aren't working properly, like anything else, it develops symptoms, and that dysfunction is either related to an under-rehabilitated situation or an over-maxed deltoid versus other muscles, or it's a structural problem that has led to that dysfunction. That's why you kind of need a team approach to figure out, well, which one is it, and then you start with one, treat that, and then you move forward before you get to the final thing, which is a structural assessment. So sounds can be from all those reasons, and sometimes you need different levels of approach to help identify them and then improve those symptoms.
Excellent. Well, thank you all so much for being here. Ultimately, it sounds like it's most important is that patients need to come in, seek care if they're having symptoms, and know that there are a multitude of solutions at St. Luke's. Great. Thank you all for being here. For more information on shoulder treatments at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-St. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.